All right, well, with no public option, you are going to get a lot of no votes, maybe from as many as 100 Democrats. The man with that prediction joining me right now, New York Congressman Anthony Weiner. So you're saying the senator or the president leaves the public option just an option, not a drop-dead one. He's going to lose essentially the House.
Well, frankly, right now, as the bill's constructed, it would be an option for people to choose. No one will be forced into it. But yeah, because what happens if you leave out the option, where's the competition? Where's the downward pressure on prices? And where is the thing that helps taxpayers? Where's the thing that helps small businesses? You need that. And it was part of the construct of the bill. And frankly, the president's been a couple of different places on it. But tonight, we get to see what he has to say. And I think what he's going to say is not only are we going to keep the public option in there, but we're going to make it a vigorous one so the consumers have a choice. That's an element of it.
He had said, Congressman, well, that's something he would prefer personally. In the ABC interview, he said there are a number of ways you can get there. This is not necessarily the way. I'm paraphrasing here. So what if he does something in the middle here? He's a pragmatic fellow. He wants health care reform passed. And he says something to the effect, all right, to get the Anthony Weiders and all behind me, if the private insurance guys don't do what I want them to do or extract the savings I expect them to, then we do Weiner's public option thing.
Well, frankly, the way that the present public option kicks in is, what, 10 years out? 2013 is year one of the bill, then there's a 5-year grace period. Look, the fact of the matter is we tried the private insurance model, and they're providing unaffordable health care, and 15,000 Americans lose their health care every single day. I don't, frankly, see the argument for dropping the public option. All it is a choice. All it is compensation.
Well, you know, the fear is that it's not just an option, it's a Trojan horse, that once in, the government just takes over everything.
Yeah, I've heard that, and I've heard that a lot of places, and none more here than here on Fox. Frankly, CBO says 4% of people would wind up getting in. I frankly think it's not vigorous enough. I think we should cut out the bank shot and say the private insurance companies aren't contributing that much. But that's not where the president is.
You could watch a lot more than just Fox to look at Medicare's history and know a program that started at $65 million a year, and last year had a budget of $400 billion, and handed out $5 trillion in benefits, was substantially bigger than it was argued in its early stages, right?
Yes, there's no doubt about it. We have many more 65-year-old and overs, and thankfully that we do.
No, but
we have more people.
I think you're pretty good at math. You would know that a growth from 65 million to 400 billion is substantial growth.
We have an actuarial problem, and it's a good one to have, that more and more people are living longer, and that's a good thing. But frankly, if you want to look at...
But it's not all that, right? I mean, it's not just accounting for the people who are living longer and more of them. I mean, it's government getting big and getting its nose under the tent, and the fear that once its nose under the tent, frankly, it doesn't leave.
It's the same bill it was when it was created 44 years ago. A lot of Americans like it for the service that it provides, but there's no doubt about it.
But if you were to ask Americans, I know, I want to let you finish that point, but if you were to ask 44 years ago that this $65 million program would turn into a $400 billion monster handing out trillions in benefits way beyond the initial beneficiaries, would Americans have signed on to it?
Way beyond the initial beneficiaries. It's still, you got to be 65, and there are more people who are over 65. There's no doubt about it, but the fact remains the arc of cost for Medicare is actually lower than it is for private insurance plans, despite the fact they're taking care of the most vulnerable population,
those 65 and over. Even when it comes to Medicare prescription drug benefits, something designed under the last president was Republican, all of a sudden the original price tag on that has quintupled.
Who's running that program?
Well, I'm just saying,
it
was dropped in your lap, though. It was a Medicare payment. What I'm saying
No, that's not fair.
If you want to say it's private insurance, I'm just telling you it is under the auspices of Medicare, your program.
We made a huge mistake, and I voted against it, giving it to the pharmaceutical companies.
So how do you know you won't repeat it? How do you know you won't repeat it?
We're not going to give it to them. If you leave it up to the way you should do it, you give it to someone like Medicare to administer directly.
You trust government.
You trust the private pharmaceutical companies that gave us a $733 billion donut hole, and now it's $1.1 trillion.
I'm not trusting anyone. I have yet to see an example, Congressman, where the savings you expect to be extracted because the government is in there has ever happened.
Do you know the overhead of Medicare?
Where is it happening?
Do you know the overhead rate of Medicare?
Do you?
4%. So you know the overhead and the overhead.
So you trust that you can get savings from government?
44 years we've seen them do a 4%. What it takes private insurance 30% to do.
So where are the great savings that you're going to realize in some sort of a health care reform effort spearheaded by the government?
You mean Medicare? Stop being so dismissive about Medicare.
No. I'm talking about the health care reform efforts where they say they can extract $600 to $700 billion in savings over the next decade. Do you buy that?
100%. I'll tell you how I know. Because we've watched private companies do 29 to 30% of overhead and profits compared to 4% for Medicare. Which deal do you prefer?
So people will be happy with the government more than they are with private insurance. Even for real quickly, even for the 80 to 90% who would question about their coverage are happy with it and the performance of it.
Every year we do a poll. We survey everyone in Medicare. 96% say they like it. If you don't like it, you're in the minority.
All right, so you're saying those 96% beat the 90% in this country who say they're happy with their policy coverage?
But actually, they say that they like their doctor, and they can choose their doctor under Medicare. If you don't like Medicare, you're with a lot of your friends who are Republicans in that building behind you. They never like Medicare.
This isn't a party argument. When you got Congressman, when you try to make this,
hold on a second. Let me finish.
You're making it a political football. I'm just telling you, people are leery of government. You like government, people are leery of government.
I'm going to tell you something. If you don't like single-payer, government-run health care, vote against Medicare. Not a single one of my Republican phony friends say that.
So you're saying, it's not a growing number of Democrats, Congressman, are telling you go slow with this big government thing because they're getting leery.
Well, look,
now you might not see that in your district in New York City, but increasingly a lot of folks are saying go slow.
I offered my colleagues in the Energy and Commerce Committee, where we wrote this bill, to vote up or down on government-run single-payer Medicare. Every Republican voted up on Medicare.
Bottom line, you want the public option, and if it's not in there, you're not supporting it.
It's going to be very tough unless they have something else in there that holds down costs, and right now there's nothing in there. Okay. No more giveaways to the insurance company.
Because you hate the insurance company.
No, I don't hate them. They're doing what they're supposed to do. Take in as much and give out as little.
All right. Jim's in it. Yep.